So quite often people straight want to go in for the barriers, or do we want to be optimistic and go for drivers' priorities? What are we thinking? Anyone got any immediate thoughts?
Barriers seems like a sensible place to start.
Yeah, go on then, see if we can overcome them. Any immediate barriers there, Lorna, then, that you have thought about over the sessions?
I think there is a lot happen. Well, from our perspective, I think there's a lot happening, and it's about avoiding that duplication and system working. So pulling all the right people together. So it sounds like it's starting to happen, Charles and Mark, which is great. So it's just about making sure, from our perspective of an organisation, that we're involved and included in that. So we, as an organisation, it's come up through the voluntary community sector work with PCNs, and it's been an area identified. So starting out, it was like we did some research, but it's knowing maybe in Kirklees, until now I know Charles and Mark are the people to go to. I didn't necessarily know that before. So, you know, in the future, maybe is there an opportunity for us to be like Leeds and have that central programme that pulls it all together?
Yeah. Lorna, just remind me where you're from.
I'm from Locala, the community healthcare provider in Kirklees. So I don't know what Mark and Charles think of that. You'll have had real hands-on experience of it.
Yeah, I'll probably agree with that, with what you were just saying there about the challenges. I think I missed that part of a question because I nipped to the toilet, but I guess you're talking about the barriers to what we're trying to achieve. Yeah,
we want to look at barriers, some drivers for it, and the priorities for the area.
So another barrier is the ongoing funding. So it's all right saying you can grab a bit of capital, but a lot of these things are about connectivity, which means ongoing costs.
Yeah.
You know, broadband and things like that. So as one of the other presenters mentioned, that the costs have just shot up. Of the 4G connections to £10 a month, which was probably half that before. So.
Wow. So there's sort of a sustainability issue there.
Yeah.
Yeah, and then I mean, just internally to Kirklees within, IT Kirklees, we have a big network contract, for example. So, but we don't have site, and partially because of COVID-19, we don't have a full understanding of what the access to building, the building strategy, the asset strategy is going to be like, and what is the access strategy, and all those things might make a difference to us if we start thinking about like hubs, sort of learning hubs and things like that. Also, what we could do with our network contracts around sort of strategic buildings and places where there is sort of social care and things like that. So it's all sorts of opportunities. I wouldn't say that, I suppose they are barriers, aren't they? But it's just like, it's having an understanding of that so we can take the right decisions now and put the investment in the right places. That's really, that's an internal thing, but I'm thinking this more wider here of the things that we've heard today, that I think that would be the whole of Kirklees, really. Because, and again, it's not just about IT or us as a service, but we really believe that our sort of relationships and stroke contracts that we've got, we could get the most value out of those. We're outgoing all into techie world. We have we've got a relationship with City Fibre, and City Fibre is Fibre Nation now, and we know where BT are rolling out and things like that. So within Kirklees, so we know there's things that we can do to influence where we get full fibre, but there's also ways that we could renegotiate our contract to make sure that all our buildings get everything that they need in terms of connectivity. Because, and again, I know it's about people and we want people's experience of technology to be good as well. We don't want a tablet, but it's always buffering and things like that. You want the strongest connection to the buildings and to be able to deliver as much as we can.
I think everyone is getting us all to sort of sing towards the same hymn sheet. So with COVID-19, all of a sudden, digital inclusion is a hot topic. Everyone wants a part of it. There's all of a sudden little pots of money. Yeah. And if we're not careful, we duplicate what we're doing, even within Kirklees. Yeah. There's probably 14 separate digital inclusion projects going on. And if we're not careful, you start you know, the DFE is giving out these laptops to children, but we had to be careful we didn't give the same children the ones when we covered off the foster carers. And then all of a sudden there might be something else that comes along that they may well be qualified for as well. And making sure that we spread it around equally.
I think there's a link there to the place-based things as well, you know, that particularly at the start of this and actually prior to, well, sort of the back end of last year, we'd sort of dipped our toe in the water with a couple of small schemes, but because we knew of them, if you see what I mean, whereas actually we now know that well, actually what we don't know is the intelligence about where we should be putting our efforts, really. I think we're getting there, but that's the other part of what we just don't have the intelligence where exclusion exists, really, and where we could make the most difference. So
and that, I think that's where the partnership working, because the data from different partners and providers will be able to give you that, and then you've got the intelligence to back it up.
Yeah, that's right. Well, like I said, to be totally honest, sometimes I think we've done some great things, but it has been, like we did that because somebody asked, whereas actually we might have been better doing some, you know, but it's great that we've done something.
I think you've started,
And that's the other challenge to us, just in the techie world, and this is something Charles knows a lot more than I do about, is like, what are the sort of, you know, get to a point, this is what we believe, anyway, get to a point where you have a sort of a standard offering, so you know you can make it secure, so you know you're not putting people at risk and things like that, and you know you can lock it down to a certain point, you can wipe it and things like that, so it becomes much more sustainable than, oh, well, we gave 6 of these things to this group of people, but once they finish with them, you won't, you know, they won't be of any use to anybody, sort of thing. So which be interested what Leeds was saying about the lending scheme. I mean, we need to find more out about that, because I think that's our ultimate, you know, that's one of the objectives we'd have, that we'd have sort of a, you know, a collection, so whatever the better description is, of devices that we can lend out, and that we know that they'll go to the right people.
So historically, internally, sorry, go on.
No, you go first.
I'm slightly moving it on, so you go.
Yeah, so that was one area that the third sector have identified, that there is a need. You know, there's lots of training and support services and organisations providing that around digital in Kirklees, but what they felt that the community were asking for and needed was loaning devices. So we have started doing a little bit of research into that, and there's an organisation called Aspire in Greater Huddersfield who did that for the over 55s. Now we're taking that, looking at what they're doing at the moment, and looking at putting a proposal together to try and secure some funding to, say, for example, 50 devices in North Kirklees, 50 in Greater Huddersfield, to test out and pilot a loaning scheme. So it'd be really good to work with you closely on that. So that we don't duplicate anything.
I mentioned in when I was talking about the 65 devices we're looking at getting to support people getting back into work, and that's meant to be a loan scheme. You get the device so that you can look for your jobs online, you can do your applications in Word and everything else like that, and then you can return the device hopefully when you're successfully back into employment. But there's also I'm trying to think now. Community groups as well, perhaps got an idea, they've got some money come in and they think they're doing the right thing by grabbing hold of some Android tablets, but if you're not careful, they're doing things, they're causing themselves a bit of a problem in terms of the devices are not cleaning down between use, not in terms of hygiene, but also in terms of content, passwords, bank details, if people are doing online shopping, and they need to make sure, we need to think about our role within Kirklees as to how are you going to step in and sort of say, well, if you go through this scheme, we'll make sure the security is great, because we don't support end users. No. We just support the device. In libraries, you know, the librarians might help people on a device, but we just make sure that the device switches on, you can get to the basic internet and office, but we don't actually support the individual. And likewise, we wouldn't do that with community groups. And it's figuring out, well, actually, is it worth us stepping in and setting a standard and saying, look, you know, it might cost a little bit more to buy into it, but you're getting something that's secure and that's, you know, that's sustainable moving forward.
Yeah.
Just
And
in
I think
terms
that
of sort
model
of-
would work because the community groups can provide that support and the training. It's about having
Yeah.
that tech support, isn't it?
Yeah.
So just in sort of terms of group priorities, I wrote sort of as you were all discussing, sort of if we want a good and positive experience to digital, but sustainability and sort of longevity to keep things going is really important. Some sort of potential standard package or a scheme where you can lend out, or you know you've got that bank of equipment. Anything else in the sort of main head priorities?
No, only just to make sure that the right people, that people know how, if we go back to that partnership, maybe I suppose that one of the objectives of that to make sure that, collectively everybody, not in everybody in Kirklees, but those people that need to know how to access this, and that we meet in those sort of requirements. And I suppose that's something that we need to understand, really. So.
You mean in terms of sort of wider public, like the promotion of?
No, I suppose the wider the services and things like that, the stakeholders, who are the key stakeholders in that, So again, I'm just reflecting on, we might talk to, and I'm just probably saying this more from our selfish point of view within Kirklees and IT, is that we might talk to adult and social care, but we might not talk directly to Lacala, but actually we should do, if you see what I mean. I know you can't make it too broad, but we need to make sure that we've got the relationships with the right people.
Yeah.
I mean, pre-COVID, we spent some time studying people coming into the customer service centre and asking them questions, because our customer service centre is face-to-face, but we offer online and over the phone in the same building, so we try and signpost them. And when people did come face-to-face, we asked them, why couldn't you use the technology that was on offer or do it at home? And there was very much a subset of people that can't do it. There was a subset of people that won't do it, and the subset of people that haven't done it. And it's thinking about which ones you're trying to target them all, but in reality, there's some people you probably just can't engage with, and it's trying to make the best of the others.
Do you also? Oh, sorry.
Right.
Okay, fine. Just going back, do you think so? A priority would be, because you guys mentioned that you don't have the intelligence at the minute of where the exclusion actually exists. So would a priority be where this is where the partnership comes in to to ensure that we get that intelligence of where the exclusion actually is.
I totally agree.
Yeah.
It was interesting. We've been having groups within Kirklees about reopening key services, and I went to the first one talking about libraries, and one of the libraries mentioned about people getting access to books, but they also mentioned about opening up the IT. And they said, obviously, these people that really need the assistance, and we ended up spending 3/4 of the meeting talking about what digital inclusion really was. And actually, how do we go and demonstrate who is digitally excluded, and what support do they need? Is it the device? Is it the connectivity? Is it the training? Is it hand holding? And that's the hard thing, really. Getting a device is the easy thing, really. We know what we're doing there. It's sort of highlighting who needs help and what do they need help with.
I'm glad you were asking those questions. We had to ask each other this morning what our all sort of explanations of digital inclusion was.
Oh.
We were like, just in case anyone asks.
I think that's super important. Understanding.
Any other sort of drivers that you feel are pushing this work, apart from obviously COVID? Anything more from locality for your area, or things that you feel sort of nationally?
I think COVID has pushed forward some of the things we probably wanted to do for a long time digitally. So it's about making things more accessible and easy for the service user, but also it's about making services more efficient as well. But obviously COVID has made things happen a bit faster.
I think it's a double-edged sword, isn't it? Like, it's like,
Yeah.
digital's here, but you know, all those sort of things we said earlier, how we make it safe, is it sustainable?
Yeah.
It's all right if everything's digital, but there's, as Charles said, there's those people who just won't engage, and you know, not to leave them behind. And how will we capture them?
Yeah.
Any other thoughts? I'm not sure how long we've got left in the room.
A couple of minutes, I believe.
Yeah. How is it? Have you had your first digital work network meeting within the council?
We did have one July time, I'd say, and we've since again internally we've been to the Kirklees Gold Partnership with our ambition around digital inclusion and the tactical things we've done. And I ought to not be too cynical, but it was a bit like, oh, well done, that's really good. What are you going to do next? It's
Next,
well, actually, we were actually asking for some steer, really. But so because but I do think we've got that now. I do think we've got that. But if things have started to move a bit more rapidly in the last couple of weeks. But I'm expecting the terms of reference for that group from our sort of policy and partnerships people today. So and I'll share those with you.
Oh yeah,
you know,
brilliant.
I've got your email address. So just so, and I'll, you know, I can't completely influence who attends, but I'll make sure that, you know, I'll tip you off, so to speak, about who's going to be there, and make sure that we reference yourselves. So, but it really is sort of just an introductory meeting at the start to say how you know, what are we trying to achieve here. I mean, I think my own personal view is we're trying to achieve something different for Kirklees, so that we're all joined up with it, and that we understand what the benefits are and what each bit plays, you know, what roles we play, and that we're reaching everybody. So, you know, so again, I'm just speaking off the top of my head here. When you mentioned Lacala, and I mean, Charles might laugh at me, but we work quite close with Lacala, single point of contact.
Yeah, that's great.
They co-locate in our contact centre.
And what a difference it makes. Yeah.
But we need to think of it in different contexts as well, don't we? So but sometimes we only see our IT role, and so yeah.
That'll be good.
But that goes. The only thing I would say, and I've only got 30 seconds left, would be, and maybe outside of the adult side of it, isn't the healthcare, is the skills part, and our partnership with the college and things like that. You know, that could be for residents, but it could also be for staff as well, because I think there is going to be much more reliance on technology, and it's as much about confidence than it is about how do you do it. It's like a lot of people have got lots of native skills, really. It's just about reinforcing that you have got skills. All right, I'll shut up.
See you later.